Motion to instruct on H.R. 3080, on which the yeas and nays were ordered. The clerk will report the title of the bill.
H.R. 3080, an act to provide for improvements to the rivers and harbors of the United States, to provide for the conservation and development of water and related resources, and for other purposes.
The question is on adoption of the motion. Members will record their votes by electronic device. This is a 5-minute vote.
And it should be the last recorded vote of the day. This is a vote on instructing conferees in that conference with the Senate on the Water Resources Bill. It's a 5-minute vote. Later today in the House, we expect to hear from Republicans talking about the Affordable Care Act in the wake of the President's comments earlier today announcing changes to the health care law that would allow insurance companies the option to keep offering consumer plans that would otherwise be canceled under the law. The Associated Press says the administrative changes are good for just 1 year, though senior administration officials say they could be extended if problems with the law persist. We're going to show you the President's comments from earlier today, tonight at 8 p.m. Eastern, and of course you can also find that in our video library. Now, tomorrow in the House, the members will take up Fred Upton's bill, the chairman of the Energy and Commerce Committee, his bill allowing people to continue to use their insurance policy if they want to. That bill is set for tomorrow on the House floor.
On this vote, the ayes are 347 and the nays are 76, with 1 recorded as present. The motion is adopted. Without objection, a motion to reconsider is laid on the table. Read this one. Pursuant to Clause 8 of Rule 20, the unfinished business is the question on agreeing to the Speaker's approval of the journal, which the Chair will put de novo. The question is on agreeing to the Speaker's approval of the journal. Those in favor say aye. Those opposed, no. In the opinion of the Chair, the ayes have it, and the journal stands approved. Recognize. Without objection, the Chair appoints the following conferees on H.R. 3080.
From the Committee on Transportation and Infrastructure, for consideration of the House bill and the Senate amendment and modifications committed to conference. Mr. Schuster, Duncan of Tennessee, Lobiondo, Graves of Georgia, Mrs. Capito, Mrs. Miller of Michigan, Mrs. Hunter, Bouchon, Gibbs, Hanna, Webster of Florida, Rice of South Carolina, Mullen, Rodney Davis of Illinois, Rahal, DeFazio, Ms. Brown of Florida, Ms. Eddie Bernice Johnson of Texas, Mr. Bishop of New York, Ms. Edwards, Mr. Garamendi, Ms. Hahn, Mr. Nolan, Ms. Frankel of Florida, and Mrs. Bustos. From the Committee on Natural Resources for consideration of Sections 103, 115, 144, 146, and 220 of the House bill, and Sections 2017, 2027, 2028, 2033, 2051, 3005, 5002, 5003, 5005, 5007, 5012, 5018, 5020, Title 12, and Section 13002 of the Senate Amendment, and modifications committed to the conference. Mrs. Hastings of Washington, Bishop of Utah, and Mrs. Napolitano.
Does the gentleman from Kansas seek recognition?
Mr. Speaker, I ask unanimous consent to take from the Speaker's table House Resolution 1848 with a Senate amendment thereto and to concur in the Senate amendment.
Does the gentleman mean to call up H.R. 1848?
I do.
The clerk will report the title of the bill and the Senate amendment.
H.R. 1848, an act to ensure that the Federal Aviation Administration advances the safety of small airplanes and the continued development of the general aviation industry and for other purposes. Senate amendment.
Is there objection to the original request of the gentleman from Kansas? Without objection, the Senate amendment is agreed to and the motion to reconsider is laid on the table. Oh, you're coming up?
Right. The Chair will now entertain requests for 1-minute speeches. For what purpose does the leader rise? Without objection.
Mr. Speaker, millions of Americans are coming home and opening their mailboxes to find shocking news. Their health care plans are being taken away from them. The President broke a promise we knew he couldn't keep, and now millions of Americans feel betrayed, wondering why their health care plans are being canceled. Mr. Speaker, the House is not in order.
The House will be in order.
Mr. Speaker, this letter was sent to me by a constituent. His name is Bruno Gora, and he is a constituent of mine in Richmond, Virginia. He's a self-employed individual who purchases health insurance through Anthem Blue Cross Blue Shield. A few weeks ago, he was stunned to receive this letter in the mail, and it clearly reads, "To meet the requirements of the new law, your current plan can no longer be offered. Any new plan could cost Mr. Gora thousands of dollars more. Why should he or anyone else be forced to buy a different insurance policy if they are happy with the one they have? With every new day that passes, we continue to learn more and more about people in the same situation. Mr. Gora and this cancellation letter represent millions of Obamacare victims across the country who are having their health insurance ripped away from them. As a result, we House Republicans will put the Keep Your Plan Act on the floor for a vote tomorrow. The only way to stop every cancellation letter is by full repeal of this law. However, this bill will hopefully begin to ease some of the pain that working families are feeling because of President Obama's health care law. Tomorrow, we will see who will put their constituents before politics and vote for a bill that could allow Americans to keep their plans. I sincerely hope that my colleagues will act as a united voice and take the first of many steps to provide relief to the American people from the many, many burdens brought about by Obamacare. And I yield back.
The gentleman yields back. For what purpose does the gentlewoman from New Mexico rise? Without objection.
Oh, and to maybe put this way down. Mr. Speaker, on Veterans Day, I had the honor of speaking at a veterans ceremony in Albuquerque, where I was reminded of our solemn responsibility that we have as lawmakers to do everything we can do to stand up for those who stand up for us. That's why last month I introduced the Veterans Independent Living Enhancement Act, bipartisan legislation that will help disabled veterans live independently and participate in family and community life. Currently, only 2,700 veterans in the entire country can enroll in the VA's highly successful independent living program each year. Now, when you compare that to the 2.6 million veterans of the Iraq and Afghanistan wars alone, it is clear that this number is far too low, preventing veterans from getting the services and support they need. My bill, which has both Democratic and Republican co-sponsors, along with the support of a dozen different veterans and health organizations, would remove this arbitrary cap so that every veteran would benefit from the independent living program who can participate in it. Mr. Speaker, I urge the House to fulfill its responsibility to our nation's veterans and their families and take up this common sense bipartisan legislation. I yield back.
Gentlewoman's time has expired. For what purpose does the gentleman from California rise? Without objection.
Mr. Speaker, the President's announcement today does little to change the need for Congress to act. The President's promise, if you like your plan, you can keep it, is an empty promise. Sadly, 1 million Californians are now finding out firsthand in the form of a letter that their current plan has been canceled. One of those 1 million Californians happens to be a constituent of mine from Bakersfield, California. He wrote me recently to tell me how Obamacare has failed them. He writes, "Our youngest son was born with a rare genetic condition that results in severe mental retardation, an inability to walk or talk, and a need to be tube-fed directly into a surgically implanted port in his stomach. Our longtime insurance carrier, Kaiser Permanente, has been great about caring for our son, who requires 24-hour care and special medication and formulas, all which are very expensive. Well, we just learned today that our previous coverage, not cheap by any means, with a premium of nearly $1,000 a month, is no longer available. And that for a far inferior replacement plan with less coverage and more out-of-pocket expense that will cost $626 more a month, bringing our total to over $1,600 a month. With the added out-of-pocket expenses we anticipate for his care in the coming year, we expect to pay about $24,000 more for the care of next year than this year, all thanks to ACA. That is why we must take up and pass Keep Your Health Plan Act. And we ask the Democrats to join with us, to keep a pledge, to keep a promise, and stop increasing the cost for the constituents.
I yield back. The gentleman yields back. For what purpose does the gentlewoman from California rise? Without objection.
Mr. Speaker, I rise to tell the story of one of my constituents' experiences with the Affordable Care Act. Alan, from Santa Barbara County. Prior to the Affordable Care Act, his wife was paying $20,000 a year in insurance premiums. She has a pre-existing condition, so even though it costs so much, she was thankful to have any coverage at all. Now, when Covered California, our online marketplace, opened, she made a call, looked at her options, and found a plan that works for her. This plan saved them $8,000 a year, and it was a much better plan. Now, we know that the rollout nationally has been sloppy, that the law is not perfect, and that there are real issues we must fix. And we must fix those problems without diminishing the true benefits the law is giving to families in my district and across the country. So now is the time to work together to ensure all Americans have access to quality, affordable health care. I yield back my time.
The gentlewoman's time has expired. For what purpose does the gentleman from Minnesota?
Michigan.
Michigan.
Great state of Michigan. Mr. Speaker, I would ask unanimous consent to address the House for 1 minute.
Without objection.
Mr. Speaker, for the last 3 years, the President personally promised that if they liked their current health care plan, that they could keep it no matter what, period. But cancellation notices are now arriving in millions of mailboxes across the country. And in Michigan, the great state of Michigan, some 225,000 folks will see their plans terminated because of this law. That's twice the number of people who have even tried to select a plan nationwide. Now, I've heard from countless families back home who took the President at his word. They're upset, yes they are, and worried how they're going to make ends meet. A self-employed family of 3 in Bangor, Michigan, had purchased their own insurance for more than 30 years. Their Blue Cross Blue Shield plan was working well, had no deductible, $750 monthly premium. To replace it, the premium is going to nearly double to $1,393, and their deductible will jump to $2,800. In their own words, they told us they've been thrown under the bus. Sadly, they're not alone. Tomorrow, we will vote on the Keep Your Health Care Plan Act, a straightforward one-page bill that says if you like your coverage, you ought to be able to keep it. Let's keep that promise. I yield back.
The gentleman's time has expired. The chair recognizes the gentleman from, or for what purpose does the gentleman from Pennsylvania rise?
I seek permission and unanimous consent to address the House for 1 minute.
Without objection.
Thank you, Mr. Speaker, I rise to share with you the story of a couple from Catasauqua, Pennsylvania, the Zakoses. In a one-on-one session last Monday, that is a week ago Monday, Beverly and Bob Zakos of Catasauqua sat as the navigator. Mr. Hartman worked online through their application with them. This time, although they'd had a prior bad experience, the online connection worked like a charm, Hartman said. And once it's finished, the Zakoses will get a plan that will be more than $500 a month less expensive than the COBRA coverage they had been purchasing for $1,200, even without subsidies. At 62 years old, Mr. Zakos is hoping that with some adjustments to his income and his wife's Medicare, he could qualify for hundreds more a month in subsidies. And I take that from the Allentown Morning Call, and I yield back.
The gentleman yields back. For what purpose does the gentlewoman from Indiana rise?
Mr. Speaker, I ask unanimous consent to address the House for 1 minute.
Without objection.
Thank you, Mr. Speaker. I'm pleased to co-sponsor the Keep Your Health Plan Act to make sure individuals can keep the health care plans they like and need. I've asked Hoosiers in the state of Indiana to share their stories with me about their experiences with Obamacare. The stories are shocking. Catherine from South Bend got this letter from her insurance company stating that her plan will be canceled. Her monthly payments will increase from $186 per month to $329 per month, nearly double. Kathy from Elkhart's a cancer patient undergoing chemotherapy. Under Obamacare, she now has to pay over $1,200 a month just for her own coverage. And Barton, a small business owner, said his group premiums will increase up to 80% this year. These are serious problems causing incredible hardships for the very people that we represent. It's time to work on common sense reforms that will lower health care costs and improve the quality of care for our constituents. If we work together, we can get it done. Thank you, Mr. Speaker. I yield back my time.
The gentlewoman yields back. For what purpose does the gentleman from Illinois rise?
Address the House 1 minute and advise and extend my remarks.
Without objection.
Thank you, Mr. Speaker. Kathy Canick beat the system. Late last Wednesday, the 57-year-old of Libertyville became one of the first known enrollees for health insurance at the glitch-stricken online marketplace operated by the federal government for 36 states, including Illinois. I just kept trying, she said. Tell people to just keep trying and they'll get in eventually. With federal tax credits, the Canicks will pay about $260 a month in premiums, less than what they paid before. They will be able to retain their family doctor and their dentist, and their annual deductible will drop to $1,500 from $5,000. Just keep trying.
Gentleman yields back. For what purpose does the gentleman from Texas rise? Without objection.
Mr. Speaker, the House of Representatives has voted numerous times to repeal Obamacare. But the President finally admitted today that Obamacare is just not working. And so to save his flawed legislation, he has decided to selectively enforce the law, the individual mandate, the idea that you can keep your own insurance. He says he won't enforce the fine for non-compliance for 1 year. His method is unconstitutional. The Constitution requires Congress to write, rewrite, and amend laws. No president can just use administrative discretion to not enforce laws or change the law. Administrative discretion is just not mentioned in the Constitution. Selective enforcement violates the 14th Amendment. No president can just administratively change any law. What's next? Is he going to raise taxes by administrative order? Congress must write the law. The president must enforce the law. The House will address this very issue legally tomorrow by bringing up legislation that now the president seems to support. I assume the former constitutional law professor will sign on this excellent legislation that you can keep your insurance if you like it. And that's just the way it is. I yield back.
The gentleman yields back. For what purpose does the gentleman from Pennsylvania rise? Without objection.
Thank you, Mr. Speaker. Mr. Speaker, over 200,000 Pennsylvanians have been notified that they will lose their plans because of President Obama's health care law. What these numbers don't tell you are the stories of hard-working Western Pennsylvanians like Don and Karen from Johnstown. Don is a Marine Corps veteran and a former coal miner. He and Karen run a ministry that helps people in developing countries. Don recently let me know that he will lose his plan. He said, quote, "I specifically bought a health plan that met my needs. I liked my plan very much, and it was something I could afford." When Don and Karen were able to get onto the website, the plan he was offered had a deductible of more than $6,000. In Don's words, this is, quote, "ridiculous and unaffordable." Unfortunately, their story is not unique. We need health care reform that works for Don and Karen and the rest of the American people. The Empowering Patients First Act and the American Health Care Reform Act provide a good place to start and a better way on health care reform. I thank the Speaker, and I yield back.
The gentleman yields back. For what purpose does the gentleman from Oklahoma rise? Without objection.
Mr. Speaker, I rise today to say enough is enough. Enough of the rhetoric, enough of the dishonesty. Promises have been broken. We face critical situations that need to be made right. Countless Americans and many within the 2nd District of Oklahoma are going to their mailboxes only to learn that the health insurance plan they liked is being canceled. In the House, we have chosen to listen to the American people through Keep Your Health Plan Act. individuals can actually keep the plan they like, and we can clean up the damage done by this administration's failures. Aside from the consequences on individuals, business owners like me also face mounting regulations and penalties as a result of Obamacare. Small businesses provide stability to our economy and employ millions of Americans. That stability has been jeopardized by the result of Obamacare. I will not sit back and watch Americans be subject to empty promises with no solution in sight. I encourage my colleagues to join me in saying enough is enough and vote in support of Keep Your Health Plan Act. I yield back.
Gentleman yields back. For what purpose does the gentleman from Colorado rise?
Request permission to address the House for 1 minute. Unanimous consent.
Without objection.
Mr. Speaker, as my colleagues today have already pointed out, the President made this promise to the American people. If you like your health care plan, you'll be able to keep your health care plan, period. I have in my hand a letter sent to my office from Noel from Akron, Colorado, in my district. This is in part what it says. I'm a 37-year-old automotive mechanic in the family business, volunteer firefighter, devout Catholic. My wife, Heather, is a 33-year-old third-grade teacher. Our daughter, 2-year-old, and our son is 1-year-old, and our third child is due in March. I recently received a letter from Rocky Mountain Health Plan stating my existing policy is canceled as of January 1st, 2014, due to mandated government policies. 250,000 Coloradans have lost their insurance. That's more people than have now signed up across this country, nationwide, for Obamacare. Noel, you're not alone. I join you because I, too, lost my health insurance when I chose to opt out of the congressional coverage. One of the 250,000 people that lost our coverage. And it is time for this President to uphold his promise to the American people. Mr. Speaker, I yield back.
The gentleman yields back. For what purpose does the gentleman from Indiana rise?
I ask unanimous consent to address the House for 1 minute.
Without objection.
Mr. Speaker, as a physician, my goal is to make certain that every American has access to quality, affordable health care. The President and congressional Democrats promised that you can keep your health insurance if you like it. Well, we learned yesterday that in my home state of Indiana, only 701 Hoosiers have signed up successfully for the Affordable Care Act, while over 108,000 Hoosiers have had their current plans canceled. I think the people of Indiana know this promise has not been kept. Mary from Evansville, Indiana, wrote to me about this very thing. She said, our insurance is excellent. I had a heart attack a year ago. We met our deductible this year, but insurance has paid for everything recommended. 2 months of cardiac rehab, prescriptions, and even more surgery. My insurance and my doctors saved my life, and now I'm at risk of losing both. On Facebook, Andrea wrote that she was able to extend her plan for her and her son till next December, then it would be canceled. She went on to say, what happened if you want to keep your health care, you can. And finally, Alan summed up his frustration in one sentence: I will not have insurance beginning January 1st. End of story. Mr. Speaker, these are real stories that affect real people, hardworking families just trying to get by. Mr. Speaker, we need to hold the President and congressional Democrats to their promise. I yield back.
The gentleman's time has expired. For what purpose does the gentlewoman from Kansas rise?
Address the House for 1 minute and revise and extend my remarks.
Without objection.
Across Kansas, folks are struggling from the effects of Obamacare. This cancellation letter is from Greg and Linda in Osage City, who wrote to tell me their son was losing his health care plan. Linda spent hours each night for weeks trying to sign up for a new plan on the website. She tried the online chat, she tried calling the number, and no one could answer her questions. They were forced to add their son to Greg's more expensive employer plan, and now their son's health insurance bill is going up 50% each month. After years of knowing about these problems, today the President tried to make good on his promise: if you like your plan, you can keep it. But for Greg and Linda, it's likely too late. The deadline to switch to Greg's employer plan just passed. They had no good options. We must continue to work for hardworking American families who are paying the price for this unworkable law. I yield back.
The gentlewoman yields back. For what purpose does the gentleman from Nevada rise? Without objection.
Thank you, Mr. Speaker. If you like your health care plan, you can keep it, period. If you like your doctor, you can keep them, period. We all remember when we heard those words. Here's an article from today's Las Vegas Review-Journal.
nearly 25,000 Nevadans lose insurance plans under Obamacare. That's roughly 27% of the individual market in that state. One of those individuals is Janet. Janet's 55 years old and battling recurrent cancer. She's had the same insurance policy for 11 years. For 11 years, that policy and those doctors have taken care of her and have kept her alive. She's currently battling a recurrence, undergoing chemotherapy, and she received this letter from her insurer on September 25th. We would like to thank you. We'd like to take this opportunity to thank you for allowing us to be your health insurance carrier. We are writing to advise you that due to the passage of the Federal Patient Protection and Affordable Care Act, effective December 31st, 2013, your standard or basic individual health plan will be discontinued and terminated. You will no longer be able to continue coverage under this benefit plan as of this date. As Janet valiantly battles her disease, the last thing she needs is the added stress of wondering about her insurance coverage. Mr. President, it's time that Americans are allowed to keep their health care plan, period.
The gentleman yields back. For what purpose does the gentleman from Texas rise?
Consent to address the House for 1 minute. Extend and revise my remarks.
Without objection.
Thank you, Mr. Speaker. Peter Ertling is a 24-year-old from Midland, Texas, who's done everything he's supposed to do. When he was 18, he began working in the oil fields as a roustabout, and through hard work and perseverance, he eventually worked his way up to field operations manager. 4 years ago, he married a beautiful young lady, and they started a family. He now has 3 small boys, and there's a 4th one on the way. But, Mr. Speaker, he's now in a bad position because of bad calls made by those lawmakers who voted for the Affordable Care Act and the President who signed it into law. Thanks to Obamacare, his company, in the face of a 40% increase in rates, has switched their health insurance plan. The kicker is that Peter's wife is halfway through the pregnancy with their 4th child. His wife's doctor is not a part of the new insurance plan, and they're going to have to spend an extra $18,000 out of pocket to stay with the doctor they like and the doctor they were promised they could keep. This is a broken promise that has turned what should be a joyful and momentous occasion into a nightmare. As he said to one of my staff, I'm 24 years old. At my age, at this point in my career, this is not something that I should have to worry about. Mr. Speaker, this is not an intellectual exercise we engage in. Obamacare is causing major problems for hardworking people like Peter and his wife in the 11th District of Texas. His wife is in tears over this issue. The American dream that he was working so hard to the American dream that he's working so hard to provide for his family has turned into a nightmare because of a bad law. This is unacceptable and it's inexcusable. And I yield back.
The gentleman's time has expired. For what purpose does the gentleman from Ohio rise?
Mr. Speaker, I request permission to address the House for 1 minute and revise and extend my remarks.
Without objection.
Thank you, Mr. Speaker. 3.5 million Americans have seen their health care plans canceled under the Affordable Care Act. I've personally heard from many constituents in my district who are seeing their health care plans canceled. For example, Anthony, who's a small business owner in my district, got these letters from his insurance plan saying that his plan would be canceled. As a result of that, there's a new plan that's available to him, but his monthly cost goes up by a little over 80%. And that's low compared to some. He's in the process of building a business, and he just hired his first employee. He told me he is scared to death to hire another employee because he just got his health insurance canceled and the cost doubled. It's just another story of how this law is hurting people and stifling job creation. I'd like to ask all my colleagues to join me in supporting Chairman Upton's bill, the Keep Your Health Plan Act. I urge all of you to support it. Thank you. I yield back.
Gentleman yields back. For what purpose does the gentleman from Kentucky rise?
I ask for unanimous consent to address the House for 1 minute and revise and extend.
Without objection.
Mr. Speaker, for the last 4 years, President Obama repeatedly promised the American people that if you like your health care plan, you can keep it. But for Melody in Lexington, Kentucky, that's simply not true. Melody received a notice that her health care plan was no longer good enough under Obamacare. And when Melody looked into options for new insurance, like so many other Americans, she found out that her family's insurance costs would go up by 250%, and their deductible would increase by $2,000. Melody, in this email, told me, "We do not qualify for any premium assistance, even though we are a family of 3 living on a single income. we are more likely to go without health care coverage because our premiums are going to cost more per year than we would wind up spending on medical expenses without insurance. Mr. Speaker, this is not about politics. This is about real people in our districts that are being harmed by Obamacare. The American people don't need apologies. They don't need temporary administrative waivers. They need permanent solutions that will protect hardworking Americans from the coverage cancellations, loss of access to doctors, and premium spikes. It's time for the President to keep his promise and allow Americans who like their health care plans to keep them. I yield back.
Gentleman's time has expired. For what purpose does the gentleman from Montana rise? Without objection.
Mr. Speaker, President Obama promised if you like your health care plan, you can keep your health care plan. But for tens of thousands of Montanans, his words are nothing more than a broken promise that has resulted in canceled insurance plans and rising health care costs. I've already heard from hundreds of Montanans who are looking for relief from Obamacare, and unfortunately, the President's recent announcement isn't a long-term fix, nor does it address the core problems of this failed law. Mr. Speaker, this is called the People's House, and I want to share the story of the people of Montana tonight in this body. Dean and Summer from Flathead County, who have an autistic son and a daughter with muscular dystrophy, who were just notified, as I spoke with the mom last week on the phone, that their rates are going up $4,500 a year because of Obamacare. Or take, for example, Jim, a business owner in Troy, Montana, who will need to cut employee hours to avoid paying the Obamacare fine and keep his business afloat. Or Anne Marie in Miles City, Montana, whose family is facing an additional $3,000 per year in health care costs due to increased premiums and deductibles. Or Paula, a health care provider in Kalispell, who is questioning the viability of her private practice and her ability to continue providing care to many of her patients. Montanans deserve a permanent solution, not a short-term politically driven patch. I will continue fighting to fully repeal Obamacare and working toward real solutions that protect Montanans' access to their doctors and the health care plans they want.
The gentleman's time has expired. For what purpose does the gentlewoman from Michigan rise?
Unanimous consent to address the House for 1 minute, revise and extend.
Without objection.
Mr. Speaker, President Obama misled the American people about Obamacare, and now he's admitted it. And here's a letter to me from a small business owner in my district. My husband and I have a small medical education business, and ever since Obamacare passed, our business has been cut in half. Doctors are not spending money on education, so for the last 4 years, our business has really suffered. Then we were told we could keep our insurance. We had good insurance, not junk. We currently pay $514 a month with a $2,000 deductible. We were canceled as of 12/31/13. To get anything near what we had, we will have to pay $1,900 a month, which we cannot afford. So much for affordable health care. This is the first time in 30 years that we might not be able to have health insurance. We have always run our life not depending on the government for handouts, and now we are losing our insurance. I ask you, what are we to do? Americans are suffering. Yes, something was wrong, and I believe that something needed to be done, but not this. Mr. Speaker, it's time to keep the promise to the American people. I yield back.
The gentlewoman's time has expired. Which one? Members are reminded to refrain from engaging in personalities towards the President, such as alleging that he misled the public. For what purpose does the gentleman from Arkansas rise?
Mr. Speaker, I seek unanimous consent to address the House for 1 minute to revise and extend my remarks.
Without objection.
Mr. Speaker, I rise today to share the realities of Obamacare in my district, the 3rd District of Arkansas. Health insurance enrollment through healthcare.gov can be described as dismal at best. Only an embarrassing 250 Arkansans have managed to enroll. Sean Kispert, one of my constituents from Fort Smith, and her husband are self-employed and have spent over 64 hours on healthcare.gov attempting to sign up for the insurance Obamacare requires them to purchase. She then tried to sign up via telephone. That was also fruitless. The very few Arkansans who have successfully logged on have found, in over 60% of the cases, only 1 or 2 provider options offering plans that increase their premiums by as much as 600%. Rod Rogers of Sulphur Springs will see his family's insurance premiums go from $248 to $876 a month. Jeff Asher of Russellville is facing budget-busting monthly premiums of over $900. In October, my fellow Arkansas Republicans and I wrote to Secretary Sebelius to ask for more information on Obamacare's effect on Arkansans. Much like the pleas from hardworking taxpayers asking for relief from the law's suffocating regulations and overbearing mandates, our request was ignored. But we don't need a response from the administration to tell us what I'm hearing from my constituents. Obamacare is raising the cost of health care, creating uncertainty in Arkansas, and hurting Americans. We need to replace it with real reforms and focus on the patient, not the government. I yield back.
The gentleman's time has expired. For what purpose does the gentleman from Arkansas rise? Without objection.
Thank you, Mr. Speaker. The Mershon family of Gassville, Arkansas is yet another tragic example of the terrible toll the Obamacare law is taking on the American people. Small business owners and young parents, this couple has never asked their government for anything more than just to let them make a good life for their kids. Here are their words, quote, "We regret to inform you that we have lost our health care coverage. It was not Obamacare compliant. Granted, it wasn't Cadillac-style insurance, but it was all we needed. So we go to the website. Sticker shock does not begin to cover how we felt. This is an absolute outrage. We counted on what was assured to us, promised to us, that our insurance would stay intact, period. Our shoestring budget has now turned to floss. Seriously, it's beans and cornbread time," end quote. Mr. Speaker, a politically motivated administrative fix does nothing to solve the underlying issues with this disastrous law. Sadly, it looks like it may be beans and cornbread time for millions of families across our country. Is this really the affordable care we were promised? I yield back.
The gentleman yields back. For what purpose does the gentleman from Tennessee rise?
Mr. Speaker, I ask unanimous consent to address the House for 1 minute.
Without objection.
Mr. Speaker, I rise in support of the 3.5 million people who have to date lost their health care coverage thanks to Obamacare, and in support of the reported 10 million Americans who could lose their coverage between now and the end of the year. Mr. Speaker, President Obama promised again and again that Americans who liked their health care plans would be able to keep them. Well, we know now that is simply not the case. In my hometown of Ottawa, Tennessee, Lynn Davis, who moved to Tennessee to care for her elderly parents, had health care coverage she liked and could afford. Now her plan is going away, and she is likely to be paying as much as $300 more per month. That's an additional $3,600 per year for something she doesn't want and doesn't need. Mr. Speaker, this isn't right. Our economy is struggling enough as it is. The last thing the American people need is an additional financial burden thrust on them by the federal government. Obamacare needs to go. But at the very least, the President needs to keep your Health Care Plan Act up and hold his promise to the American people. Thank you, and I yield back.
The gentleman's time has expired. For what purpose does the gentleman from North Carolina rise?
I ask unanimous consent to address the House for 1 minute and revise semi remarks.
Without objection.
Mr. Speaker, I rise today in behalf of Martha Staley, a constituent from Cornelius, North Carolina. Ms. Staley is a retired nurse and a retired insurance agent. She understands health insurance better than most. Recently, she received this letter explaining that her insurance was canceled due to Obamacare, and her new plan would be twice as expensive. Quoting Ms. Staley, "There was nothing in the world wrong with my plan. What they are giving me is worse. I was told by the President that if I liked my health care plan, which I do, I could keep it. I was told by the President that the ACA would help lower my cost. President Obama made a simple, direct promise to Ms. Staley. Tomorrow, I urge you to join me in voting for H.R. 3350, the Keep Your Health Care Plan Act. The American people don't need more apologies from the President. They need results." I yield back.
The gentleman yields back. For what purpose does the gentleman from North Carolina rise? Without objection.
Mr. Speaker, I rise today in support of H.R. 3350, the Keep Your Health Plan Act. President Obama's statement that says if you like your health care plan, you can keep it, is ringing hollow with some 473,000 North Carolinians whose policy has been canceled. One of those families is Leon and Liz Russell, small business owners in Waynesville, North Carolina. The Russells were notified that their $653 a month insurance premium was going to go to $1,322 in 2014. This is a yearly increase of over $8,000. They said to me, "We cannot afford to pay it, period. What are we expected to do?" For families like the Russells, the House will vote tomorrow on the Keep Your Health Plan Act, which will allow millions of Americans to keep their policy without penalty. Today, President Obama announced his intentions to allow insurers to keep offering canceled plans. But a one-year delay does not make good on his promise. The President needs to be working with Congress to fix his flawed law. Mr. Speaker, we still have a broken website and we still have broken promises. I yield back.
The gentleman's time has expired. For what purpose does the gentleman from Florida rise? Without objection.
Mr. Speaker, the problems with this health care law won't be cured with political fixes, because this isn't about politics. This is about real people. People like Paul and Victoria Morrison of Panama City, Florida, my hometown. The Morrisons are health care providers themselves. By day, they provide care to infants and toddlers struggling with catastrophic injuries, blindness, autism, and other developmental delays. At night, they run a medical courier service delivering cancer treatments and medications. Paul and Victoria each received this letter from Florida Blue, informing them that their coverage was being canceled by the end of this year. Their plans failed to meet the law's requirements for maternity and newborn care and pediatric dental care, despite the fact that the Morrisons are in their 60s and have no children. They were informed their new plans would increase their combined premiums from $520 to $1,260 per month. Now Paul and Victoria are trying to figure out how to keep alive a medical practice that has already been reduced from a 10-county area to just one. That's a real-world impact and a real-world example on this misguided law. And that's why if you like your plan and you were promised that you could keep your plan, you should be able to keep your plan. And with that, I yield back.
The gentleman's time has expired. For what purpose does the gentlewoman from Indiana rise? Without objection.
Mr. Speaker, when President Obama sold the Affordable Care Act to the American people, he told them they could keep their health insurance if they liked it. Sadly, this promise has not been kept. Jerry, an independent contractor from Westfield, Indiana, recently informed me that his policy will be terminated because of Obamacare. Jerry has never written a member of Congress before, but losing his coverage and seeing his premium double has caused him to speak up. For Jerry, Obamacare is a broken promise. Victoria, a part-time teacher from the Indianapolis area, reached out on Facebook explaining that a policy she purchased less than 1 year ago was being canceled. She's tried to get on healthcare.gov to see what alternatives are available to her, but the site couldn't even confirm her identity. For Victoria, Obamacare is a broken promise. Dwight, a business owner from Indianapolis, received a cancellation notice from his insurer, the one that I'm holding here in my hands. Dwight's insurer is one of several insurers that have left the state of Indiana. For Dwight, Obamacare is a broken promise. Mr. Speaker, Americans deserve better. They deserve to keep their current insurance. Obamacare is nothing more than a broken promise, and I yield back.
The gentlewoman's time has expired. For what purpose does the gentleman from Minnesota rise?
Revise and extend my remarks.
Without objection.
Mr. Speaker, millions of Americans are losing their health care plans, their doctors, and their confidence in the President's new health care law. The simple truth is the facts show the law is hurting more people than it's helping. Although the President committed many times that no one would lose their original health care coverage, millions have. One of my constituents, Ron from Champlin, he's had his health care plan for 21 years. He likes his health plan. It works for him. But Ron, like thousands of other Minnesotans, received a cancellation notice. Another constituent emailed me this morning saying that his family health care plan was renewed, but the costs were going up $5,400 this year. And unfortunately, I've heard stories like these from many others in my community. Mr. Speaker, if you like your health insurance plan, you ought to be able to keep it. And no one should be forced to buy health insurance that isn't right for them or for their family's needs. I will continue to work with all those that are willing to sit down at the table to have a responsible solution and a real solution to our health care challenges. I yield back.
Gentleman's time, or he has yielded back. What purpose does the gentleman from Florida rise? Without objection.
Mr. Speaker, I asked my constituents in Florida's 17th District how Obamacare is affecting them. One said they are upset that their coverage is going to go up by more than $300. Another said that their insurance plan went from $204 a month to $720 per month and that they couldn't afford that. Others reported increases of 100, 200, even 400%. Most devastating were those that are on Medicare Advantage, who are set to lose their doctors. One woman lost her primary care doctor of over 20 years. Another whose husband lost 5 doctors, including a cardiologist, that has cared for him since his heart transplant, said that they're not able to keep their doctors or their insurance plans. Worst of all is the impact on Florida families. One gentleman in my district says, I've looked at quotes for my family of 3. It looks like it'll cost us about $5,000 more a year. I may have to get a divorce so my wife and son can afford the insurance. If I do, they will qualify for discounts we don't get if we were married. Mr. Speaker, there are stories like this all across Florida and the country. So much for if you like your plan, you can keep it. Now all of our constituents are suffering. With that, I yield back.
Gentleman's time has expired. For what purpose does the gentleman from Florida rise? Without objection.
Thank you, Mr. Speaker. The President promised Mr. Griffin in my district and millions of other Americans that if they wanted to, they could keep their own doctor. Unfortunately, he found out already that's not true. They were told they could keep their own insurance company if they liked it. Unfortunately, that's not true either. They were told it would cost less. Unfortunately, that's not true either. They were told it would not create a new tax. Unfortunately, that's not true either. They were told there would not be any rationing. Unfortunately, that's not true either. It's not right, it's not fair, and it's not good for the United States of America. Thank you, Mr. Speaker. I yield back.
Gentleman has yielded back. For what purpose does the gentleman from Ohio rise?
I ask unanimous consent to address the House for 1 minute and revise and extend my remarks.
Without objection.
Mr. Speaker, I rise to express my strong support for the Keep Your Health Plan Act. I've heard from many folks across my district that they are losing the health care they have and like because of Obamacare. Jeff from Columbus Grove wrote to alert me of the cancellation notice he received indicating his insurance policy is being dropped as December 1st of this year. He has less than 1 month to find a new plan which will cost more, have fewer benefits, and have higher deductibles. In addition, his choices for new health care insurance limit his options for the hospital and the local doctor he can choose. Dwight from Arlington wrote that he and his wife received a notice that due to the ACA, his wife's insurance policy will no longer be available. Coverage will double from $189 per month to $394 with increased deductible costs. Finally, I've heard from a local township trustee that the township has received a notice that their health insurance plan has been canceled because of the ACA. These are just several examples of the hundreds of stories we're hearing from across my district in the state of Ohio. I remain committed to enacting quality and affordable health care legislation and continuing to work towards Obamacare's full repeal. Mr. Speaker, I yield back.
The gentleman's time has expired. For what purpose does the gentleman from Texas rise?
To address the House for 1 minute.
Without objection.
Mr. Speaker, despite the President's promise that Americans could keep their health care plan, thousands of my constituents have learned that their health care plans will soon be terminated. I recently received a letter from David Hager, the CFO of a technology company headquartered in my district. He was informed that the health care plan offered by his company is being canceled. This is a well-liked plan that pays 100% of the employees' monthly health care premiums. But that is not good enough for Obamacare. This company will now be forced to pay 19% more for its health care next year, and its employees will have to shell out more money for a new plan that they don't like. This is in addition to the newly created reinsurance fee of $510 a month for the company that has to pay, that has no value at all to the workers. Mr. Hager wants to know why his employees are having their excellent health care plans canceled by Obamacare. We must allow Americans to keep the health care plans they like, not just for 1 year that has been proposed by the President, but permanently. I yield back.
The gentleman's time has expired. For what purpose does the gentleman from Pennsylvania rise?
Mr. Speaker, request unanimous consent to address the House for 1 minute and revise and extend.
Without objection.
Mr. Speaker, it was a gamble for the President to promise the country, if you like your plan, you can keep it, given that his health care proposal amounted to a complete restructuring of our health care system and 16% of the American economy. By now, every member of this chamber has received countless letters, phone calls, and emails from millions of Americans who've had their health insurance either canceled or turned unaffordable due to the Affordable Care Act. This is a devastating reality for this family. Lisa and her husband Bob from Punxsutawney, Pennsylvania. They're just one of many families in the 5th Congressional District hurt by this law. Lisa and Bob are self-employed. They're small business owners with 5 children and bills to pay. After receiving notice their affordable health plan is being canceled, they are now facing cost increases of more than $20,000 a year for a plan that actually covers less. Mr. Speaker, the only solution is a transition to health reforms that actually contain costs and expands access. The President's promise alone is certainly not enough. The American people deserve better. Thank you, Mr. Speaker.
The gentleman's time has expired. For what purpose does the gentleman from Illinois rise?
Mr. Speaker, I ask unanimous consent to address the House for 1 minute and to revise and extend my remarks.
Without objection.
Thank you. Mr. Speaker, I rise today because the American